Archiving started.
Review amino acids, proteins, non-protein nitrogen compounds, and renal function. Starting with amino acids. Amino acids are held together with peptide bonds. Of amino acids that are several in a row, we call them oligopeptides. 5 to 10 would be a polypeptide, and when we have greater than 40 amino acids, we consider it a protein. Essential amino acids that come from your diet that need to be eaten. We need to discuss the different amino acidopathies that can occur when there is an issue with the amino acid cascade that you see here. First one is phenylketonuria. Phenylketonuria is having an absence of phenylalanine hydroxylase. When you have an absence of phenylalanine hydroxylase, you're unable to go from phenylalanine to tyrosine, as you can see in this area below here. Now, this red line here is referring to the absence of that phenylalanine hydroxylase. So you end up having a built phenylalanine in your bloodstream. When this happens, it can lead to brain issues and mental retardation. So if we do a Guthrie test on a baby early on, or do a screening, newborn screening, CAT, PKU, and remove those types of things from their diet that could cause a buildup of this in their bloodstream. The Guthrie test is the bacterial inhibition assay that we use to determine if they do have that phenylalanine hydroxylase. Another one is tyrosinemia, which was where we would find tyrosine crystals in the liver, or in the urine, and we would have liver problems. Alkaptonuria is what you see up above. Urine A and urine B. Well, after the urine sits exposed to light, you will see that, or exposed to room air, it will turn black. So some students say, well, alkaptonuria is like Al Capone. Al Capone wore black. So they remember it that way. Next one, maple syrup urine disease. This is where there is almost a sweet odor to the baby's urine, and we find a leucine level of greater than 4 in the isovaleric acidemia makes you smell like sweaty feet. Homocystinuria can build up and cause things like clotting issues in people, and it can also cause early heart in people. Arginosuccinic aciduria and citrullinemia are 2 other types of amino acidopathies. And cystinuria, it's important to make note of, is an error in the transport of amino acids, not an error in the amino acid itself. So cystinuria would be a transport error. Knowing about the diagnosis of these inherited amino acidopathies, well, usually there's a newborn screen that is done in each state to determine if they may have an inborn error of metabolism, in which case they could probably prevent by avoiding those things in their diet. Okay, proteins. When we have greater than 40 amino acids in a row, we have a protein. There's different levels of structure within a protein. We've got a primary structure, which is just the sequence of amino acids. The secondary structure is where they start to fold in on each other and become kind of a beta helix. Tertiary is when it starts to really fold into a ball, and quaternary is when it's one aggregate unit. The different types of proteins of clinical significance include a total protein. A total protein equals albumin plus globulin. So here, I'll type that out for you. Total protein equals albumin plus globulin. A lot of times we do a total protein and an albumin. So the doctor would know the total protein level and they would know the albumin level. Well, if you know those two, you can simply do subtraction and figure out what the globulin level would be. It is important to know if a patient has an abnormal, making it abnormal. Is there too little albumin or is there too little globulin? A couple other proteins we're going to go over. Alpha-1 antitrypsin. Alpha-1 antitrypsin plays a role in the inhibition of neutrophil leukocytes to fight infection. It can also destroy alveoli, which can lead to emphysema. Alpha-1 fetoprotein, if there's increased alpha-1-fetoprotein in a mom's blood, it can mean that they're defects. It can also mean that a patient could have hepatocellular carcinoma. Alpha-2 macroglobulin and beta-2 microglobulin can be found in renal failures. Ceruloplasmin is, and I bring up Wilson's disease and Kaiser-Fleischer rings here for a reason, because if you have too much copper, you can have Wilson's disease, and the Kaiser-Fleischer rings are what show up around your cornea. Some students, it's easy to remember because Wilson's disease and Kaiser-Fleischer being in the eyes, they think of Home Improvement, the movie with Tim Allen, where his neighbor, his name is Wilson, and all you can see is little eyes peering over the fence. Acute phase reactions and inflammation. Haptoglobin, that carries free hemoglobin, so it can't be excreted by the kidneys. Retinol binding protein, think of retina and vitamin A. So retinol binding protein is for vitamin. Transferrin carries iron. Prealbumin is used in when people have a protein deficiency or starvation issue going on. They do this a lot on people on TPN or total parenteral nutrition to make sure that the proteins that they're being given are actually working. Another name for that you might see other than prealbumin, and I'll type it here, is transferrin. Oh, a little off kill. Okay, two other proteins, complement proteins and immunoglobulins. Those, as you know from immunology, and you'll get another dose of in your immunology review, they fight infection. On here I made note that proteins in urine and spinal fluid are important. You should not have protein in your urine. Protein in your urine means that there's something wrong, and for some reason proteins are making it through your glomerular basement, like may have broken down. So we test urine for protein quite often. Also, spinal fluid. Having abnormal proteins in your spinal fluid can mean that you have some type of issue such as multiple sclerosis going on, or it could even mean meningitis. So you'd make note of the middle of your screen here, testing methodology. For albumin, we often use a brown crystal purple or brown crystal green. Okay, non-protein nitrogen compounds. With non-protein nitrogen compounds, we get the term from what we used to have to do, which is removing protein from it before we could do the testing, using Nestler's reagent. Well, now we can do it very easily. And the ones that we usually test for are urea, ammonia, creatinine, creatine, and uric acid. We need to know some different terms. So urea, there's a bunch of terms that go with this one. Having azotemia, urea, uremia is the presence of urea in your bloodstream. But you can have prerenal azotemia, renal azotemia, and postrenal azotemia. Prerenal would be something in the bloodstream that would cause an increased uremia with the kidney itself. Postrenal would mean something like an obstruction. The next one is uric acid. This could be elevated in the case of gout. It is from the catabolism of puric acid. Creatinine is a waste product that we find in the blood. It is an excellent clearance test. We use the Jaffe reaction for that. And we would do a creatinine clearance, which we'll discuss in a minute. Ammonia, the significance of that is it is a waste product, which is normally converted to urea in the liver. But if the liver is not working, ammonia will build up in the bloodstream. Very note of the fact that you would take the tube of blood and put it on ice, because ammonia will be affected if it's not kept on ice. Know how to calculate a creatinine clearance test? We'll do that in a minute. The calculating creatinine indication of glomerular filtration rate. Let's go ahead and do a creatinine clearance here. With creatinine clearance equals V over P times 1.73 over BSA. Let me go ahead and finish this here. Okay, so there's your creatinine clearance calculation. All right, so let's do an example here. Let's say of urine. We have a urine creat of, let's say, 120 milligrams per deciliter. Units are very important. Plasma equals 1.5 milligrams per deciliter. The time it took is 24 hours, which is 1,440 minutes. We also need to know the surface area if given to you, and that would be, let's say, 2.0. Okay, so we have everything we need here. We just have to fill it in. Okay, so I'm going to do this right next to this over here on top. We need the urine creatinine, which was 120, times the volume. Now the volume is going to be the total volume, which is 1,200, divided by 40, because we have to have mils per minute for volume. We then divide that by, so you guys can see all this. The plasma, which was 1.5. And if we do that calculation, 1,200 divided by 1440, that equals times 120 divided by 1.5 times 1.73 divided by 2. So our answer is 28.8. That is what your body is able to filter per minute, or what your kidney is able to filter per minute. Now, I did forget to put here the 2.0. Go ahead and add that quick. So that would be how you do a creatinine clearance.